Well, good morning. I'm Cynthia Lee, and you're watching Focus on South Texas. We are talking about a hot topic in the news for many, many months, and that's President Obama's health care overhaul. It expands coverage to some 30 million uninsured people, which means that insurers will not be able to turn people away, and virtually every American will be required to have health insurance. But the Affordable Care Act could hit you in ways that you did not expect, everything from pancakes to pizza. Here today we have Brooklyn Chandler Willy. She's the president of Texas Financial Advisory. And I guess the very first question is, what is Obamacare? I mean, what kind of, it's just a generalization.
Well, Obamacare is what people have dubbed it, and really it's called the Affordable Care Act. And what this is just like you said, Cynthia, an overhaul of our health insurance system. And to break it down, really it's three key things. Everyone's entitled to health insurance is what it's allowing. It doesn't matter what your condition is, how serious it is. And what this means is that conditions that weren't previously covered prior to now will start to be covered. So if you connect the dots, that tells us that health insurance is going to become that much more expensive for private insurers.
Okay, that's a great question, because I remember when I was self-employed and having to apply for health insurance, you know, everything was about the pre-existing condition. Oh my gosh, you had the flu, we were not covering you. I'm exaggerating, but so
it doesn't matter.
It doesn't matter now.
Doesn't matter. You could have had multiple heart attacks, cancer. I mean, you're the same health-wise as someone super healthy.
Wow. Wow. Okay, but then this has to, I'm guessing that now it's going to cost the healthcare providers like your company a lot more money.
Exactly. And I'm self-employed, and so I've already seen that happen this year. And Obamacare is not in full effect really till 2014. But on average, it costs a family about $15,000 a year for health insurance, and or about 15% of their income. So there's really no way to estimate what we're going to be seeing, but we know it's going to be going up. So, now's the time to start making some changes and other things that you can control so that you can absorb that cost.
Well, and I think what's scary too is I've heard that some employers are just going to not offer benefits.
Yeah, and that's their option. So then they will be penalized as an employer. But when they're weighing the options, it may be cheaper to pay the penalty, because the requirement is that if you have 50 or more employees that are full-time, then you have to offer health insurance or pay $2,000 per employee. So if you do the math,
you're right, it's cheaper to pay the penalty.
Yeah, I mean, it's $100,000 a year for 50 employees, $166 a month for each employee. I'm probably guessing that it's going to cost more to insure them. So that's the employer's option that they can take. But the employee also has an option that they can pay a penalty and not have health insurance also. So it may be cheaper for them to pay the penalty, and that's 2.5% of their income. So
wow.
Any way you turn around.
I can't have any more jobs. I already have like 5 jobs, Brooklyn. So, obviously we on this show, we're not going to debate, any kind of politics, but, there are obviously pros and cons to just any issue that goes through Congress. So, it is what it is.
Right.
It is what it is. And so what we want you to talk about today is, how do families protect themselves from getting in a hole with this health insurance?
And it's being educated on the matter. And just like in any sort of financial issue, if you have your head in the ground, then it's going to go by you, and you're going to be paddling upstream. So, the key is to be aware, which we're doing here. We're talking about it, and making those small changes that you can do now to be able to absorb that cost down the road. And we're talking like within a few months we're going to be seeing this, because it doesn't come in effect till 2014, but the wheels are in motion.
Okay, so even though I know we just went through our benefits meeting, and I don't remember, things changing too much. So it's this year, we're all still kind of safe, but
right, but think about the open enrollments that are going to happen in the middle of the year.
That's when we're going to start really seeing the impact. And so does that mean that they would, they're going to start maybe taking more money out of our paychecks every round?
Right. Yeah.
Okay.
So the cost is going to go up now, and the full-fledged Affordable Care Act does not hit until 2014. So now we sit here and go, well, what do we do in this year alone, because the penalties aren't in place. the employers either just drop health insurance altogether because they're not required in 2013 to have it. So this is going to be a weird year to see what happens.
That's true. It's just good just to know that you have something. We got something, health insurance, I'm covered. As long as I can make it to the doctor, right?
Right.
And then this is just kind of an off-the-wall question, but let's just say all of this ends up being a disaster. When can Congress make a change? Would it be 4 years, or is it every year or every 2 years? I can never remember.
I mean, it's under President Obama, so I would think things would not change while he's in office.
Okay.
That's my own opinion. But whenever the election was happening, there were all these reports coming out in Forbes and different magazines reporting that even if Obama did not go in office, the wheels were in motion, that it would cost billions of dollars to stop what's been in place. They've hired thousands of tax IRS advisors that are coming in to put this, to make sure this is in place, that they'll be penalizing the employees.
That's right. I heard a friend of mine whose husband is a doctor said that the same thing, that they voted for Obama, and they're not even Democrats, but they voted for him because to undo everything that had already started would have been a disaster in itself.
Right. So, I mean, this is what we're facing. So no matter who had gone in office, now obviously President Obama is in office now, so I doubt he will change anything.
Right.
I mean, I'm
right.
not
so
on the
up
and up.
Right. So for 4 years, we got to start saving a little bit more. I don't like to save money, Brooklyn. I like to spend money. I just bought 5 boxes of Girl Scout cookies.
Well, but that's for a good cause.
That's for a good cause. And a good meal, right?
Right.
So what are some small changes? I mean, it's tough to make these changes.
Well, we've heard, and as you mentioned earlier, that we're going to be seeing changes in the cost of anything from pizza to cheesecake and what I'm getting at there is these employers that have large businesses, franchises, things like that have multiple employees, they're going to pass the cost of the health insurance onto us as consumers. So the CEOs of Cheesecake Factory, and Papa John's, and a franchise owner that owns 40 Denny's has come. They've already said, okay, we'll absorb it. I mean, we will honor what is being told for us to do, but the cost of our goods are going to go up.
Okay.
So us as consumers, when we go get our pizza, it's going to be a little more expensive.
Interesting. But I guess that just comes with the territory. I've sort of always been in the mindset it's going to cost us no matter what, no matter who's in all, something's, right. We're going to eat that cost somewhere. So.
And just the state of our economy right now, I mean, we've known that in order to dig our government out of this deficit that we're in, this trillion, it's almost trillion. Yeah.
Okay. I knew it was something big.
Go to there's a website called usdebtclock.org, and you will see every 4 hours we go another $1 billion in debt. I mean, it's incredible.
Wow.
Yeah. So, in order to combat that, we have to have higher taxes, and then that means inflation.
Right.
So here we are.
So maybe even just not getting that coffee every day.
You're going to have to make
with the mocha
small
whip,
changes.
Whatever. I don't drink coffee. What is it? Grande mocha whip.
I don't know. I've gone to black already.
You're already down to black coffee.
I know.
Because think about it. It's David Bach. I think his coffee theory of, if you don't drink that, stop every day, it's like adds up to this, and if you invested that money, then you would save it.
And it's all about the compound effect. The small things that you do can add up, but if you don't make those changes, then people are going to start going into more debt and have a crisis there. So.
Well, this was just fun and positive.
I know. Really uplifting.
On a weekend morning. No, but you know what? Just in general, it's good to save money, coming from someone who's not that great at it. Thank goodness my husband saves it. But it is good. Just in general, just be prepared.
Yeah. I mean, it's going to happen whether you want it to or not.
So what would you suggest? We need to wrap up in just about a minute. What would you suggest, just one little thing that you could do that most people do every day, like the cup of coffee? Stopping and get that coffee every day. What would you say is like one easy step?
Well, I think you take an inventory, and I don't know who said it, but I plagiarize them and say it takes 21 days to create a habit. So if you will take an inventory of what you're spending for 21 days, like literally write it down, you'll be able to see some costs that you could cut out. Maybe an extra trip in the car because gas, of course, is going up. So little things to see where you can cut those costs because you're going to be incurring another bill down the road.
Okay, good advice. And let's see, Brooklyn, your website. Go ahead and tell us your website.
If you go to my website, it's texasfinancialadvisory.com. You can actually click on, I have a link there, and it says Obamacare. If you click on that, you can go to a calculator, and it will help you calculate, the different changes that are coming our way.
Okay, thank you so much for being here, Brooklyn.
Thank
The
you.
time flies, right?
I know. Imagine that.
We appreciate it. All right, thanks a lot. We will be back with more Focus on South Texas after the break.